Okay, I think in the interest of time, let's go ahead and get started. I know we're still waiting for one of our panelists to join. She sometimes does have some technical difficulties linking from DRC, so hopefully she'll be able to be online in a few minutes. So greetings, everyone. Welcome to the panel on strategies for building a fit-for-purpose supply chain health workforce. My name is Bridget McHenry, and I'm an institutional contractor for USAID's Bureau of Global Health, where I work on commodity security and logistics for the Office of Population and Reproductive Health. Over the course of the next hour, we're going to share with you various perspectives and programs that illustrate how USAID and its partners are investing in and maintaining an adequate and well-trained health workforce that incorporates supply chain responsibilities and knowledge at all levels. First and foremost, our approach takes a holistic lens, acknowledging supply chains as complex systems that function within broader public health systems. As such, any initiative to address supply chain workforce development must take these systems into account. Today, you'll be introduced to the STEP 2.0 program, hopefully, assuming our panelist is able to get online. STEP 2.0 is an integrated leadership development program that pairs the public and private sectors to develop and deploy leadership competencies to address real-world public health supply chain challenges in real time. STEP 2.0 meets the needs of public health supply chain executives by blending elements of self-paced learning, facilitator-led training, and on-the-job application of leadership skills with pro bono coaching support from a cadre of private sector supply chain experts. Modemoke Eomba will hopefully be with us today to provide her context-specific perspective on the deployment of the STEP 2.0 program in the DRC. We're also joined by Inez Buki of the GHSCS-PSM project in Rwanda. Inez will be able to share her perspectives on implementing the People That Deliver Supply Chain Management Professionalization Framework. This groundbreaking framework includes tools, materials, and presentations that establish a set of global standards that align career path, education, and professional growth in health supply chain management. The goal is to achieve professionalization, whereby health supply chain management is transformed into a recognized profession of the highest integrity. This work is a culmination of a series of initiatives in Rwanda that have built one upon the other to achieve the kind of holistic approach that USAID seeks. And now I'll turn over to Caitlin Morgan, who's going to introduce one more USAID initiative, the DREAMS program, and our final panelist, Glenda Maitland.
Great, thanks, Bridget. So first of all, thank you all for joining us today. I wanted to briefly introduce the initial work we're doing to expand PEPFAR's involvement in supply chain workforce development as it pertains specifically to the DREAMS program. So the Office of HIV/AIDS, OHA, through the Supply Chain for Health Division, is looking for opportunities to expand its involvement in supply chain workforce development. We're encouraged by several opportunities that are creating pathways to wage employment and entrepreneurship for adolescent girls and young women who participate in the determined, resilient, empowered, AIDS-free, mentored, and safe, known as the DREAMS program. So one great example of the types of initiatives that we'd like to replicate in other countries is the partnership between USAID South Africa and the Association for Supply Chain Management, with which Glenda Maitland, who is one of our panelists today, will be able to talk about further and expand on how that initiative was able to provide training to DREAMS beneficiaries, so young girls and women, and connect 60 to 70% of participants with employment opportunities. So really outstanding work. So our main priority, as I just mentioned, in this work is to be able to connect young women with jobs so that they can start building towards advanced careers in supply chain. So we're also able to address any of the gaps in supply chain workforce by equipping these adolescent girls and young women with specialized knowledge and skills that make them successful in the workplace. So most recently, the Office of HIV/AIDS and the Bureau for Resilience and Food Security released the Youth Employment RFI, so request for information. So this RFI is an invitation to private sector businesses to engage with USAID and the 16 Dreams countries on economic strengthening activities that they think would be best suited for Dreams beneficiaries. So these partnerships could include internships, entrepreneurship, or wage employment opportunities. USAID has a strong belief in the capacity and soft skills that Dreams beneficiaries obtain through the participation in the program. And we really do think that these girls will be very successful within the workforce given the right opportunities. So I will paste a link to the RFI in the chat for everyone to reference at their leisure. And just to highlight that the applications are due December 15th. So that's it for my portion of the presentation, but just want to, I think we introduced all the panelists. I can just run through a quick introduction for Glenda. So Glenda Maitland is the founder and managing director of Bridge Building OpEx Solutions, a firm that improves overall business efficiencies by engaging people and aligning systems into processes that deliver a continuous stream of value to clients by eliminating deficiencies in the process. She has over 20 years of experience in capacity development, supply chain optimization, and results management. She was a transformational coach, mentor at Return to Self Limited, held positions at the Association for Supply Chain Management as a program director for the Supply Chain for Health in our Global Health Supply Chain Initiative, and several supply chain operations and management leadership roles throughout her career. So I'm really excited to have her on this panel to talk more about the work that she's engaged in with our Dreams beneficiaries in South Africa. So over to Dominique. Thank you.
Hi, everyone. Good morning and good afternoon. My name is Dominique Suinkos, and I'm the executive manager for the People That Deliver. And I'll speak a little bit more later about our initiative, but I think we would like to move now into the actual panel discussion. We have a number of questions that we're going to ask our panelists. And so I'm just going to start off with just asking a question specifically about professionalization of the supply chain cadre. And I'm going to ask Ines about this. So if you could please explain, in your experience working on developing a professionalized body of supply chain workers and creating pathways for career advancement in supply chain, how has your work sort of addressed this, as well as the gaps in your country and in your health program context? So over to you, Ines. Thank you.
I think Ines is actually having some audio issues right now.
Oh, okay. Well then, thank you, Andrew. I'm going to then let Glenda answer that question. Thanks.
Apologies, Dominic, just a bit of technical challenges. Could you just repeat the question, please?
Yes, of course. So the question is about the professionalization of the supply chain cadre. And if you could explain what your experience is working on developing a professionalized body of supply chain workers and creating pathways for career advancement, if you could speak to that as far as your experience. And then if you can also sort of talk about some of the work that your work has addressed to deal with workforce gaps in both the country and health program context.
Okay, so first of all, obviously, as ASCM and as BPOPEC Solutions, we believe in improving professional development, improve supply chains, that ultimately improve supply chains, obviously strengthen our economies, and that the strong economies improve lives. So the partnership with the Dreams program has actually allowed us to increase the professionalization of supply chain professionals within our country. So we work together with government, obviously, to renew their commitment in upskilling not only the youth, but supply chain professionals in public and in private sector. So our essential supply chain management program focuses on foundational principles in logistics, inventory management, and operations that will be applicable across all retail and manufacturing and healthcare sectors. So by bringing that in, we're starting from the bottom in improving professionalization of the supply chain profession. Is there anything
Perfect,
unclear?
perfect, Glenda. Thank you for that. Excellent answer. Ines, would you, did you hear my question?
No, Dominique, can you repeat?
Okay, not a problem. So basically, I'd asked Glenda this question. I hope you can answer as well. But and especially with the work that you're doing in Rwanda currently. But if you could explain your experience working on developing a professionalized body of supply chain workers, as well as creating pathways for career advancement in the supply chain. Thank you.
Thank you, Dominique, and I apologize for the technology issues. So I think in Rwanda, as in most of the country, you know, access to health product is one of the main priority of the government. So of course, this priority has been impacted by like factors such as like stock out or low quality of product, right? And we realized that one of the main issue was actually, you know, linked to the supply chain workforce, right? Where in the lower level of the supply chain system, we have staff that, you know, mainly supply chain work are run by nurses, and they have pretty much a standard job description, whether it's a nurse that work in the maternity or work in the pharmacy. So there was also a lot of staff turnover because it wasn't really a priority at the health center, which is actually one of the low level of the supply chain system, to really keep and dedicate a nurse to to deal with supply chain activity within that facility. So what we actually did at the beginning, we realized also that the investment that the development did, I mean, the donor like USAID and even the government were putting into training were really very expensive, right? So we couldn't continue like that. So we actually sit with the Ministry of Health and say, how can we tackle that and the cost for supply chain activities such as training, right? So we have developed like an online health supply chain management course that currently are available in the Ministry of Health platform to at least allow whole supply chain workforce at all the level of the supply chain to access this course, at least to have that as a basic. And we also work with the professionalization, I mean, the professional association to ensure that, you know, member of the association can take those courses freely on a regular basis. So one of the things we also look at is like, how can we address that holistically and more looking at, you know, the professionalization framework in the country. So we really work with the Ministry of Health to ensure that we can conduct actually a whole labor market assessment to really look at what is where do we see supply chain workforce in Rwanda? What is the pathway? What is the demand in the country? So I think many things was done, and the Ministry of Health has Human Resource for Health Department and Secretariat who took over this process. We had a stakeholder workshop to align and make sure who are the partners that we should work with to ensure that we can establish a professionalization framework for supply chain in Rwanda. So the work is really ongoing, and we have categorized that work in how can we look at different sector and different organizations in the country and start to deep dive into these different sectors, like the Rwanda Medical Supply, which is a central medical store, looking at what is their need, right? How can we embark and talk to the academy so that, they can consider further training and further professionalization training to respond to this gap in the health sector. Over to you, Dominique.
Thank you, Ines. Thank you. Very great comprehensive answer. I'm going to pass it on to Bridget for the next question. Thank you.
Inez, if you will stay off mute, I'm going to ask you first, and then Glenda, I'll come to you on this one. What are the approaches that you recommend that will not only encourage women to enter the supply chain workforce, but also to help expand their positions within the health supply chain? So are there specific approaches that you can think of that you would recommend?
I think one of the things that need to happen at the country level is first, as a country and government, to recognize the supply chain workforce need, right? Supply chain should not only be, warehouse clerk. I think people should understand that. So how can we, through the Ministry of Health, promote the supply chain work that is done? How, we've seen many often time supply chain doesn't come as a priority. So in our work, we deal with disease program, but we have every time to push. They remember about the supply chain where there's a potential stock out, and so they don't remember that it's really an important part. So when a program go and conduct training at the low level to ensure that there's a new treatment guideline that is established and people get trained on how to implement that, they often forget about the supply chain part. So on our level, we've been pushing to really get our stakeholder and the government counterpart put supply chain at the forefront so that we can also be an integrated part of that training process. You know, when there's a new HIV molecule that's coming in the treatment guideline that's been revised, you need to teach the nurses that deal with logistics on how they are going to actually dispense this product with other regimen. How does that link? How do they implement that? How are they going to manage the inventory stock for that? So I think advocacy, keeping educated, and work with the Ministry of Health to put really the supply chain forefront will also actually push women to understand what is the supply chain. They always think that supply chain means I have to pull a box, I have to carry a box. So we need to educate people so that the interest could go beyond just men, but also women can be interested in that profession. Over to you, Bridget.
Great, thank you so much for that illuminating answer, Inez. And Glenda, now I'm going to ask you the same question, which I'll repeat for you. What approaches do you recommend that will encourage women to enter the supply chain workforce and also to expand their positions within the public health supply chain?
Thanks, Bridget. One of my favorite subjects, women in supply chain, and how we can increase the amount of women in supply chain in any industry or any sector within your country. So no matter who or where you are in your supply chain career, you need to start caring about advancing women in the field. That's because women make our supply chain organizations stronger and the positions of our companies more sustainable and profitable for growth, right? So the workforce actually of the future demands that we inspire confidence and recognize individual unique value. Who better to do it than a woman in the supply chain industry? So one of the key, a couple of the key things that I would recommend is refine and groom your talent pipeline to match the changing skill sets. Once you understand your place of the maturity scale, consider ways to identify and foster for the future. For example, this could include sponsorship with the Female STEM program or collaborating with existing organizations. So the PEPFAR Dreams program is a beautiful example of that, where we're actually taking young women from the rural areas and educating them on supply chain, and then placing them into the private sector companies, whether it's your inventory clerk or forklift driver or procurement clerk. So they start to get to understand that at the ages of 18 to 24, and they become part of the company's talent pool. Secondly, do a deep dive internally to understand the current landscape of women in your supply chain function. And if there are any pain points for attraction or retention that can help tailor your approach, best to go to the women that's already within your organization and get that first-hand knowledge from them. And embed inclusion in your talent strategy. I mean, I'm going to say it again, increasing the number of female supply chain professionals is not only a proven growth strategy, it also offers a competitive advantage, not just for your organization, but for our country as well. Thank you, Bridget.
Great, thanks so much, Glenda. And before we move on to the next question, in order to keep this a dynamic discussion, I'm wondering if any of the participants today would like to come off mute and share your reflections, your suggestions on specific initiatives that would help increase women in the public health supply chain. Yeah, Ella.
Thank you, Bridget. I think the two ladies, Ines and Glenda, have spoken very well, but I think, you know, when it comes to private sector, it's not so much an issue because today, you know, people know what they want and they will go for what they want. When it comes to private sector, it's not so much an issue. And look at this, where it affects women and children, you know, in programs. So for me, if there's a way by which the donors and funders can ensure that the programs that they fund actually demonstrate or rather reflect inclusion, you know, reflect a diverse workforce. You know, I've come from a program in Ethiopia where, you know, decisions were being made about, you know, in the selection of the product, in the distribution of the product, in the procurement of the product, but these decisions were being made by men who do not understand how all these affect different people differently. And so we didn't have any senior leader at the higher level at all. We had one person who was at a deputy director general who left, and there was no one at all. So by the time we were leaving, we made sure that they had a gender mainstreaming strategy and a manual and a clear audit that we conducted. So really trying to, you know, it's more like affirmative action. And when I'm saying this, I'm very conscious because it's not about dishing jobs to women. It's also about credibility because we are dealing with human issues that require women who are able to make wise supply chain decisions and then supporting them to do that. I mean, when you find women leading such operations, they will do it consciously, knowing that it's going to affect another woman in the hospital corridor who will understand the challenges of stockout. So that can be on the side of the donors like USAID or any other fund. But we as women in supply chain, we are the role model. You know, women like to see others do what we are telling them. So we are the examples by, you know, how we have been able to go through that journey, but also how do we hold their hands? You know, each of us has to hold one person's hand, take them through the process, but also equip them with the right knowledge. So there's so much that can be done in this area, and I think the time is now, and we have more women today. So we really need to think of the beneficiary beyond just having the numbers. And we have to be conscious because it's not about tilting the scale on one side. I have seen cases where there's so much drive to recruit more women, and then you end up having more women in an office than the men. When the time comes for maternity, it's like they are all out. So we have to also be able to balance the equation. Thank you.
Thank you, Pam, for that, the insightful answer and a really salient example that you provided. Judith, I noticed that your hand was up for a moment. It's not up now. Did you want to come off mute and share?
Well, I was applauding for Pamela. I totally agree with her. Actually, the point I had written down was women lifting women. We have quite a number of women in the supply chain field right now. And if we set up, I don't know if the STEP program or any other program currently has a mentorship aspect to it that would ensure that we are coaching and mentoring other women in the supply chain field to be able to see what's in the future, what's their career path in this profession. Thank you.
Bridget, if I could just add on to
Please.
What Judith mentioned. So just also let know that the DREAMS program is led by women in supply chain, right? And we mentor women. So going back to what Pam said about women actually being in examples to show that it can be done in supply chain. You can be a supply chain professional as a woman. So with this program, for example, like I'm leading the program, but my facilitators are women that are supply chain professionals. So when these young girls, when these young women actually get trained by the facilitators, they see that it's possible for them to actually be a facilitator as well and to be a woman in supply chain. So just adding on to what Judith and Pam says, fully agree with them.
Great, thank you so much for that, Glenda, and thank you participants for that dynamic discussion. I really appreciate that. I'm going to now pass the mic over to Caitlin for the next question for our panelists.
Sure, thanks, Bridget. So the next question for our panelists, we have a bit of a preface to it as well. So the emergence of new trends and approaches to supply chain, such as outsourcing for warehousing and distribution, and the focus on supply chain data visibility, require adaptations and bring in new skills into the supply chain workforce. What trends are you seeing in your country and the health program context that are influencing the demand of supply chain management professionals? Can we start with Glenda?
So automation, so changing demographics, let me start there. So I think resilience as a key focus to, as that of risk prevention, that's number one, but also introduce supply chain as a career path quite early within your organization or Ministry of Health or within your whatever sector that you form part of, right? So we know that COVID-19 has accelerated a technology change. And one of those are warehouse automation. And the just-in-time delivery has also adopted that as an effective way to maintain optimum production while reducing cost. However, the pandemic has exposed this as a weak link. So our practice currently relies on manual workers. So that's where the warehouse automation comes in. That's my answer, Caitlin.
Could you talk a little bit more about what are some ways to introduce supply chain as a career path earlier on? I know we have the DREAMS program initiative that you're working on, but do you see any other opportunities for, opening up opportunities for students or young professionals in Africa to gain those supply chain skills that are desperately needed in the industry?
Yes, definitely. So I know within Africa and various countries within Africa, we have what we call internships and learnerships. So where you bring the unemployed youth onto a program and you take them through a supply chain management certification. So you do 3 months training and you give them skills within the classroom. And then for 9 months, they actually get placed in a different sector. And you find some of the youth wants to be in the public health sector, others wants to be in private or whatever industry. So that's that's two of the things that I know our countries do, and that is very encouraged within South Africa.
Thank you so much. So now over to Ines, and I'll read the question again, if you don't mind. So again, the emergence of new trends and approaches to supply chain, such as outsourcing for warehousing and distribution, and the focus on supply chain data visibility require adaptations to the supply chain workforce. What trends are you seeing in your country and within the health program context that are influencing the demand and supply of supply chain professionals?
Yeah, so I think one of the things we've seen in Rwanda is in the recent, in the past year is the growing interest into regulatory, work. I think every aspect of regulatory work for the pharmaceutical sector in the past was led by the Ministry of Health. So the government has now established a Food and Drug Authority, which is only 2 years old recently. And you see like the demand in terms of supply chain workforce or workforce itself, in that sector and that aspect of the regulatory that is missing in the country. So you could see that already there's growing demand into how can we ensure that we have also those workforce that has these skill sets. So we've seen also the establishment of from a pharmacy, let's say, or science, faculty to draw that is in an institution like a supply chain center that has been put in place by the Ministry of Health and the government of Rwanda, just to focus on training supply chain workforce, because the demand, they've seen the demand growing in terms of supply chain. So one of the next step, like as a country, that we are looking out and through the professionalization framework is that how can we not only train pharmacists, because it's clear that a pharmacist is not a supply chain. It needs additional training and skill to be a supply chain expert. But we have beyond only pharmacists. We have been seeing, the growing into regulatory work in country now with the manufacturing coming through this COVID pandemic and all these initiatives that Rwanda is also buying to establishing a manufacturer. We also need this new demand skill in the country. So I think one of the things that as a country we've seen is it's slowly, but it's coming. They've recognized the need for supply chain experts. And by putting in place this Center for Excellence to train people and supply chain experts, I think this will also help the country to increase the skills. But of course, I think we've mentioned about technology. That is one of the things. So we need also to adapt the learning and the skills to technology. Supply chain has requested more and more data analytics work, right? So we also need to look at that. I think one of the things that we face as a project, a challenge, is when we have to recruit supply chain experts. We get a mathematician, we get pharmacists, we get people with different background that haven't really, doesn't have understanding of the supply chain. So we also have through the program, an internship program where we take students that are coming to the last year, and then we take them around all the different work that we are doing in supply chain. So I think if we've seen that growing demand and that new skill set that is required in the sector, and I think we need to keep educating people, and the Ministry of Health need to be aware and continue to work on this professionalization framework. Over to you, Kathleen.
Thanks, Ines. Just another question for you. Really interested in the internship program and bringing on new skill sets for students. But are there partnerships that you all are working on with universities?
The partnership that we have so far is with the Center for supply chain excellence, where we actually work with them, and they're also one of our partners through this professionalization efforts. So we basically work also with the National Pharmacy Council, where we offer, it's still unformalized, but we have this opportunity where wherever we have and we're in need of data collector, or we are in need of, you know, human resource to support a huge activity, we often go to them and make sure we can include them. And through that process, this is how we ensure that we can at least, because at the end, we still have to recruit, we have a program to run, and we need to ensure that we have resources and skill in country. Over to you, Kathleen.
Thanks so much. And we have a question also in the chat, and I'm going to pronounce this incorrectly, and I apologize in advance. Motozut. So how do you ensure that implementation of supply chain solutions always embed change management activities? You know, setting aside trainings, besides training, to create a fit for purpose environment while managing resistance. And I assume you mean resistance to change management. So bringing that over to the panelists, go ahead.
Yes, so I think I want to share and one support we provided to a faith-based central medical store, and that was with the support of USAID and Bridget, which was not only to, I mean, the objective of it was an inspirational leadership for change management for supply chain, which was not meant to provide supply chain skill only, but also taking the organization and stakeholder of this organization through a process for change management. So it's quite an extensive process because it required them to, at the end, come up with a project, a capstone project, and we need to continue. We actually continue to follow up the implementation and monitor the implementation of that capstone project. So it was a success because we just didn't, you know, provide a training, but we ensure that they can use this training to ensure change management within the system. So I think it was a success. They really took over that process, and we've seen cohesion between the faith-based central medical store and its stakeholder because they kept the momentum and the dynamic to be able to make the change, and we've seen improvement in that supply chain sector as well.
Glenda, opening the question up for you to respond as well.
So when it comes to that, whenever you implement a solution, I think change management is key. It should be part of your solution. So just like Ines says, that I agree with all the comments of, you know, you first start educating with change management principles, and you have to get rid of that resistance through the principles that you're going to apply. So my opinion and the way I work and the way we implement programs is doing the change management first before you come up with the solution.
So Glenda, that's more of you know, a collaborative effort and discussing that type of change or whatever the proposed, or coming at a problem with an open mind and really trying to build with your stakeholders what your solution might be to that supply chain workforce challenge. So that's excellent.
Yes, yes, correct.
And I see we have another question in the chat. I think we can go to this one, and then I'll hand it over to Dominique. I'll read through this question. So the use of legacy systems as well as manual processes has given rise to pockets of data and information at different supply chain points. In a decentralized system, this makes it impossible for decision makers to make informed data-driven decisions on supply chain planning activities. The revamp and use of technology could assist in this regard. However, the strategy often needs to be driven by the Department of Health and not necessarily the partners. As partners, what role can we play in this space? Flipping that to our panelists.
Glenda, are you on? Okay, maybe I can go ahead. Yeah, so you're right. I think so I think as an example in Rwanda, we have a more decentralized system. We have information system that is mainly driven by, like you say, the Department of Health. Here is the Ministry of Health. And our role as partner is to help with the implementation of, let's talk about the existing system here, which is the electronic logistic management system, the ELMIS, which is used by whole health facility and at central level to make the order and to also process requisition and also ensure that consumption information are recorded and the stock are managed through the system. So we've seen really ownership through the years, and this is over the past 10 years of the Ministry of Health. But of course, our role as partner is to support project implementation, to support training, because I've mentioned one of the challenges we have faced in the supply chain in Rwanda is the turnover of supply chain workforce at the lower level. So we have to make sure that we work with the Ministry of Health, the disease program, to ensure that we continuously fill the gap in terms of training, wherever there's change in the workforce or staff turnover. So this has been our main role, to ensure that project implementation. One of the roles, also critical role that we've played, is to ensure data quality through the system. Of course, a system can be there, but a system is only effective when people use it and use it appropriately. So, so there's a need for consistently ensuring that you get closer to the health facility, look at their data, use the data, show them how you use the data for decision making. So we've established and pretty much institutionalized a supporting supervision, where you have the Ministry of Health and different program diseases at central level will perform a supervision with the regional medical store. They take them through the data quality aspect. They take them to the training into the existing system. Wherever there's an enhancement in the system, they need to be trained. And then this level of the supply chain, which is the regional, they at their level take down the supporting supervision to the health facility. So they also have what they call, on a quarterly basis, they look at the data quality aspect within the region and they address the concern. So I feel role that we should continue to play as partner is to guide and ensure project implementation, but also to work with them to ensure that the data that are in, information that are in, are of quality. So over to you.
Glenda, would you like to respond to this one? I can briefly respond as well. I think your question really brings up some interesting thoughts about data visibility and having the workforce that's able to, what's the word exactly, support these really highly specialized data systems. So your programmers, and how do you develop those skills within the country and have the university capacity to train individuals in programming skills so that they can support data visibility of the health system and other, areas. So I just want to bring up a quick example. We do have a project in Zambia that is actually offering internships, through the ECMS project to potential programmers that can be really helpful, to make sure that our systems stay online and do everything they need to do. So over to Dominique.
Yeah, thank you, Caitlin. I realize we have 2 minutes left in this panel discussion. So I'm just going to ask Andrew or Sydney, if you could just put up the slides I sent to you. Thank you so much. I was going to ask a question around COVID-19 because this panel is about, building a fit for purpose workforce. And we've seen, of course, with the onset of COVID-19, that there's a real need to look at building a fit for purpose supply chain workforce. As Glenda so rightly said, the pandemic has really exposed the weak link here. And by creating that strong fit for purpose workforce, we're dealing with this issue straight ahead. But just within the last minute that we have, just wanted to highlight People That Deliver, which we call PTD for short. We are a coalition of like-minded organizations that are working together towards strengthening the capacity of the health supply chain workforce, but also really working towards promoting that professionalization piece. And that's what I wanted to highlight here. And in this slide, just showing you that we're a convener of sort of diverse organizations, leaders in the technical information on human resources for supply chain management. And our main purpose in life really is to advocate for supply chain professionals. Next slide, please. I with this, just wanted to show you our professionalization framework. It's a framework built around sort of 4 components. In the center, we really have the library of competencies and designations for a career in supply chain management. We have a full resource of supply chain roles and job descriptions that is aligned with those competencies. And then we have mapped out over 250 courses that supports your career in the supply chain. And as you've heard Ines talking, we have this implementation approach for health supply chains, and Rwanda is a shining star in this as leading forward with our work here. And then, yeah, final slide, please. And that just to say, if you have any questions, want to get in touch with us, interested in implementing the professionalization framework in your country, please get in touch with us. And thank you so much for attending the panel discussion today. I want to thank Ines and Glenda. Tremendous effort to be part of this panel discussion. And thank you, Bridget and Caitlin, and USAID always being at the forefront as well. So thank you.
Amazing. Thank you to all the panelists for the first session. We're going to switch gears and we'll be hearing from Judith Oyoni and Janet McKenna from the In Supply Health. They'll be presenting about how adaptive learning can be used to monitor supply chains in Kenya and Tanzania. So I'll turn it over to Judith and Janet. I also have a slide deck I can share, and I also know there was a video shared, so I don't know if you wanted to share some of that, so just let me know what you want me to present.
Hi, Andrew. We were expecting that you'll share the video, so if you could kindly pull that up.
Absolutely, I can do that right now.
Thank you.
Okay.
Hello, everyone, and welcome. We are glad to have you join us for this presentation, where we will share our experience in using adaptive learning to evolve impacting data use approach for monitoring supply chain in Kenya and Tanzania. My name is Judith Anyona. I work at InSupply Health as a senior advisor. I have been designing and implementing and managing health projects for the last 15 years. My background is in social sciences and international development. I am joined by my colleague who will co-present. Janet, please say hello.
Hello, everyone. My name is Janet McKenna. I am an advisor at InSupply Health with over 8 years of experience in monitoring, learning, and evaluation and health systems strengthening. Thank you.
Okay. We will be turning off our videos due to bandwidth and to ensure that clarity of our presentation. We will begin with a brief background about our organization, InSupply Health, and then focus on the impact teams approach where we have applied adaptive learning. We will then introduce adaptive learning, why we have used it and how we have used it, while citing process challenges that we experienced and how we mitigated them. We will also highlight examples of adaptations that resulted from this adaptive learning workstream, and finally share with you some conclusions and key takeaways from our experience. So who is InSupply Health? InSupply Health is an advisory firm that provides customized guidance on supply chain management and design to our clients and is affiliated with John Snow Incorporated Research and Training Institute. We seek to transform lives by co-creating innovations and sustainable solutions for health communities. We empower clients to set their priorities and collaborative design solutions for their challenges to shape their own healthy futures. While our team is local and has an understanding of the context, we have a regional and global outlook and are driven by empathy, which allows us to collaborate with our clients to introduce innovations and adapt to their needs and contexts. I will take you through the impact teams approach that we have been implementing, where adaptive learning has been applied. Impact team approach is a system of interconnected teams that are multidisciplinary and are trained to develop, interpret, and set targets for key supply chain indicators. The approach provides a structured and rigorous process for supply chain problem solving. Using action-oriented dashboard, impact teams identify issues within the supply chain, apply problem-solving skills, and make operational and strategic decisions that are geared towards improving performance of their supply chain. Simply put, ensuring that commodities are available to clients and that health facilities are adequately supplied and stocked. The impact teams are established at different levels, with the lower levels meeting on a monthly basis and higher levels meeting on a quarterly basis. The approach has been implemented in 3 projects at InSupply Health in different settings. These projects include the Data Use Tanzania, covering 3 regions, Data Use Kenya, covering 4 mainstream counties, and finally, the Scale project covering 4 arid and semi-arid counties in Kenya. Each of these projects had unique characteristics. For example, the health function in Tanzania is under the national government, and therefore, any stakeholder engagement by the data use project requires buy-in from the national government before cascading downwards to the regional level. The implication of this was that any new adaptation to the impact teams in Tanzania required a longer turnaround time as compared to Kenya, where health is devolved to the county governments. Adaptive learning has served to not only monitor the effectiveness of impact teams approach, but also to iterate and evolve the approach. I will now hand it over to Janet, who will take us through adaptive learning, what it is, and some examples of where we have used it. Janet?
Thank you, Judy. Traditionally, design and planning is done at the start of the project and these plans are implemented as designed, while routine monitoring takes place until the end of the project. Monitoring, evaluation, and research always helps to generate very rich evidence-based lessons. Oftentimes, these lessons are documented and used to advise future cycles of programming rather than applying them to deviate the program from what was considered fundamental at the start. Adaptive learning is a monitoring and evaluation approach that uses implementation experiences to inform decisions and deliberately take actions in order to learn and adapt as needed under conditions of ongoing uncertainty. Embedding adaptive learning in our work puts learning at the core of our implementation, making the impact team's approach agile and flexible to accommodate changes that are derived from our learnings. The adaptive learning process entails these key steps. The first step is need identification, where we apply different approaches to identify and prioritize an area to focus on. There are needs that are being escalated by the teams and those that come up from our routine review of process and program data. Once a priority topic is identified, the second step would be data collection and analysis, where the information is triangulated and an agenda for the adaptive learning deep dive sessions outlined. These are facilitated discussions held on a monthly basis to identify the problems and apply structured root cause analysis techniques and prioritize a few problems or issues that we want to address. An action plan is thereafter generated, during which different team members are tasked with the responsibility of moving forward these activities. The last step is the implementation of the actions. This process entails curating or developing solutions, testing them, and implementing these solutions and adaptations. To close the loop, we review our action plans periodically to ensure that actions are completed. We also review the adaptations post-implementation to document them. As earlier mentioned, the adaptive learning sessions always start by sharing key insights obtained from analyzing the data. We use virtual collaboration platforms such as Miroboard during our brainstorming sessions to identify problems, their root causes, and solutions. A key consideration in this process is the need to ensure the solutions are suitable to fit unique needs of the different projects or setting. The team can be separated into smaller units to ensure contextual consideration of the solutions. In the example highlighted on this slide, we were using human-centered design approach to solve a challenge, and this session focused on refining prototype ideas that had been generated by our users during the HCD prototyping workshop. We had 3 groups, each focusing on one prototype idea. The implementation of adaptive learning has not been without challenges. We allowed ourselves to learn from our experience to iterate and strengthen the process into what it currently is. We started with quarterly adaptive learning meetings, which we later realized were not enough. We then switched to bi-monthly meetings, and finally, monthly meetings that we found to work best. From assessing our processes, we identified completion of action plans as a weak link. We also lacked a mechanism to review our adaptations and document our learnings. A retrospect into our adaptive learning processes helped us to develop this adaptive learning cycle that aided in resolving the challenges. We assigned clear roles to the different teams. The adaptive learning team led the process of identifying the agenda, topic, gathering and analyzing the data, as well as facilitating monthly adaptive learning sessions. Then the adaptive learning champions and the learning guiding coalition were responsible for elevating the learning needs and promoting the adaptive learning culture. They also helped to evaluate the adaptations post-implementation and document successes and failures, and where necessary, designing experiments. All these teams had representation from the different projects, which was key in ensuring that their needs are considered. We also have overlaps of team members across these teams to ensure seamless collaboration. Then our three project teams are responsible for driving the implementation in their impact teams and providing feedback from their experience. In addition to the monthly adaptive learning sessions, we identified other meetings to move our adaptive learning agenda forward. The adaptive learning team had weekly planning meetings. The different coalitions held bi-weekly meetings where the execution of action plans was done. On a need basis, we also constituted working teams to move forward with specific tasks. We are now going to look at some specific examples of how adaptive learning has supported improvements of the impact teams approach. When we rolled out this next generation of impact teams, it was designed for system-based implementation. We defined this in a number of ways, including maturity of data systems, existence of routine meetings, resources, structure, etc. We went ahead and categorized the impact teams into basic, intermediate, and advanced using a self-assessment that we had designed. About 8 to 10 months into the project, as we monitored the implementation, we realized that our approach hadn't changed based on how we had categorized the impact teams, and we weren't seeing the results that we had hoped for. So we convened through our adaptive learning and ended up going through HCD processes with our impact team users. What we realized was that it wasn't really about the context so much as it was about the people and the set of skills and competencies that are needed to make up a data use team. This includes skills and competencies like a supply chain expert really requires to understand the indicators and identify where the breakdown is within the supply chain. Through that HCD process, we developed these 7 role profiles that make up a data use team. We changed the initial assessment that we had designed, that teams categorized themselves as either basic, intermediate, and advanced, and developed a new self-assessment, which teams use to assess their skills and competencies related to these 7 role profiles. And here is just an example of an output of that assessment. Teams are rated on a set of skills, but also in terms of availability or accessibility of that role profile to the impact team. The self-assessment made the teams aware of their competencies and skill gaps, and also the need for different team members to take up roles rather than depending on maybe 1 or 2 team members to do everything and relying on those individuals for the successes of that team. The role profile assessment, and from what the results identified as the gaps amongst teams, allowed us to target skills development to those particular role profiles. We curated self-guided learning packages tailored for each role profile. So for a team that may have realized that they lacked capabilities in analyzing and visualizing their supply chain indicators, they can strengthen these capabilities by taking up DataWiz, the Diana learning package. As we were adjusting our implementation through our adaptive learning processes, we also realized we needed to adjust our monitoring tools to fit this new approach, while we also addressed other gaps identified. One key gap was around sustainability and institutionalization. In addition to utilizing process indicators and supply chain indicators to monitor progress by impact teams, we developed an internal dependency assessment used to measure the team's level of dependency. The assessment is focused on assessing dependency along 3 dimensions, namely technical, coordination, and financial. This process allowed us to ensure that the support we provided each team was focused on improving areas where they were struggling to reduce their dependency and become more sustainable. There has been a gradual increase in the number of teams that are at low dependency over time. From the impact team side of things, we introduced a process where the teams created sustainability plans with actions geared towards figuring out how to sustain their wins, mitigate their challenges around sustainability, and also closing the loop using the continuous learning process. This sustainability planning was done jointly with the impact teams and their county leadership as part of strengthening the leadership engagement process. We did a deep dive in one of our adaptive learning sessions to look into action plans and saw that low-hanging fruits or actions that did not require resources were being completed, but the rest were left pending month to month. While impact teams had the opportunity to roll over these incomplete action items into their next monthly meeting and subsequently to their next action plans, the templates that we had developed posed a challenge in terms of visibility of those pending actions, or what we call loss to paper trail, because each meeting generated separate documents or minutes. And as the meetings increased, it was not easy to refer to all these separate minutes if a team wanted to assess or study for patterns around those actions that are pending with an aim of doing things differently. This resulted in the development of an Excel-based action plan template that has a running log where a team would log all their action plans and they can easily review them over time. Then we have this challenge that we are currently working on, strengthening the involvement of the higher level impact teams. We are using the adaptive learning to engage with the leadership, to enhance coordination with lower levels, implement reward and recognition for high performing teams, and help sustain the impact teams approach. As we wrap it up, we would say that the key advantages of adaptive learning is that it allows us to move away from traditional M&E so that interventions can really be tailored to the context. We no longer have to wait until the end line or until the end of a project to get results and then create a new project. Rather, this allows us to have timely and relevant data to really adjust how we do our programming throughout. I'll now hand it over to Judy to take us through some of the conclusions.
Thank you, Janet. So for adaptive learning to work, it requires a supportive funder and implementing partners, as the process needs resources and flexibility to adjust in real time. When using mixed methods, you will need multiple data sets and stakeholders who are willing to engage. All those adaptations we've made have been in partnership with our end users. Their strong commitment and willingness to engage with us as we iterated was very useful. Finally, you will need researchers and evaluators who have a good understanding of program implementation and are committed to continuous improvement. Here are some takeaways on adaptive learning. Program adapting should be deliberate and methodical. It should be based on data and implementing experience. It should be systematically documented to provide structure and institutional knowledge so that we are not recreating the wheel. It should respond to the actual problem. And finally, it should be consultative with the end users. This brings us to the end of our presentation, and we welcome any questions from you. Thank you so much for participating in this session. We will be happy to engage further with you through the email addresses as provided.
Thanks, Andrew. We can open it up to any questions. I see we have about 3-4 minutes. If there are any questions, we can address that.
People can just come off mute, or they can put it in the chat if they prefer that.
Sure. Sydney says we have 5 minutes.
Looks like Pamela.
Yes, Pamela, go ahead.
Yeah, thanks so much, Judith and McKenna. A quick question from me. I mean, is this a tool for you to track and monitor your project, or is this something that you would expect your client, and by that I mean your government staff that you work to support, be able to use by themselves? And because I heard you say that it requires investment, and the concern would be that these things can work while you are there, and then when you are gone, even if they have the knowledge and they lack the resources to support it, then it becomes a problem. Over to you. Thank you so much.
Thank you. Janet, do you want to take that?
Sure, I can take that. So it's an approach that we have used to incorporate into our programming, our monitoring, learning and evaluation approach. So we pretty much use it as we're implementing, or as we implemented the impact teams approach, to just identify areas where we could pick some lessons and utilize those lessons to make some adjustments as we move along. I don't know if that's clear.
Just to add to what Janet has said, it's one of the monitoring and evaluation approaches. The difference is with this one, whatever we learn as we implement, we are able to make changes immediately. So we don't have to wait until the end of the project to be able to implement. So this gives us time to make changes as we go along. And what we meant in terms of partnership is that, people sometimes do not accept frequent changes. And sometimes these frequent changes are required to make to make the implementation smooth. So adaptive learning has been useful for us to be able to learn as we go and even apply human-centered design. I hope that answers your question, Pamela.
Yes, I was just typing to say thank you so much for clarifying that.
Great, thank you. Okay, so with 2 minutes left, I don't see any other questions. Thank you for participating. Please feel free to reach out to either Janet or myself. We'd be happy to engage you further if you want to know more about what we are doing at In Supply Health. Back to you, Andrew.
Thanks, Judith. Just one last plug. So after this session, there's a networking session following, and it will be extended to 2 o'clock now. So everyone get excited for that. And just maybe if everyone could do a virtual round of applause, go down to reactions. You can do the little clap for our panelists today. Awesome. Thanks, everyone.
Thank you.
Thank you.
Bye.